So have you been getting pain in the front of your knee, especially when you go to squat, try and get up from sitting or go up and down stairs? If you have, you might have what's called Patellofemoral Pain Syndrome or kneecap pain. So today I'd like to show you how you can tell if that is what you're suffering from, what you can do to try and help it, what not to do, and also when you should seek some professional help. Hey everyone, Ting here with Physical Therapy Balance Centers in Hazleton. And patellofemoral pain syndrome is usually a condition that happens when your kneecap isn't moving properly because of either tightness on the outside of your knee or weakness on the inside of your knee. What this does is it causes it not to move right and causes rubbing under the kneecap, which typically is what creates the pain. Pain with patellofemoral pain syndrome is typically in the front of your knee. A lot of times it can happen on the inside, and not so often, but it also can happen on the outside of your knee as well. With patellofemoral pain syndrome, typically you'll get pain if you sit with your knee bent for too long, if you have to squat or get up from a chair, and also when you go up and down steps, especially going down. So if you think you have patellofemoral pain syndrome, there's a couple of things you can do at home to try and help out with the problem. One of the first things you can do, especially if you know you're going to be doing activity like housework or yard work, try and place some heat around your knee just to make sure the muscles are ready for the activity and also you get the blood flowing. After you've done activity, however, make sure you put some ice on there because after activity your knee could be swollen and it could help out with the pain and decrease the circulation to the area. With patellofemoral pain syndrome, the structures on the outside of your knee, including your outer quadricep and also your IT band, can get very tight. So self-massage, using several tools. You can use foam rollers, you can use a rolling pin, but one of the massages that we like to use is a percussion massager that can really help you get into the outside muscle and loosen things, especially the deeper structures. Before you exercise, make sure you always stretch. The key muscles that's been found to be tight in patellofemoral pain syndrome is the hamstrings and the calves. So make sure you stretch the hamstrings out. Typically you can do it laying on your back, which can be better for your back pain and also for your calf muscles. Another thing you can do to try and help out is to fix any alignment issues that happens in the knee. So research has shown that sometimes orthotics can help, and there are also braces out there, especially ones that can control your kneecap. The ones that we like is called the True Pull, and this one can also help control your kneecap while you're doing activity. A taping technique that you can do is also kinesiology taping, and what that does is it helps align the kneecap to make sure that it's working properly, plus also take some of the stress off the inside of your knee to allow your kneecap to track properly in and out, which is what it needs. With this technique, the first strip of tape slings on the outside of your kneecap, which helps pull your kneecap inwards. The second strip of tape starts slightly under and inside your knee, and it wraps around the inside, covering the quadricep muscle up to about your mid-thigh. What this tape does is it helps unload the inside of your kneecap, which gives it less resistance, and also helps facilitate the quadriceps muscle, which helps with kneecap function. The last thing you can do is make sure you do some exercise. With patellofemoral pain syndrome, typically what happens is the muscles get weak on the inside of your knee, the hip, and also the core. So if you do a core exercise like a plank, a hip abduction exercise laying on your side, and also a straight leg raise or squat, which helps with the quadriceps muscles. So how do you know you should seek some professional assistance to help with patellofemoral pain syndrome? Well, first of all, if you are in severe pain, 10 out of 10 pain, your knee is red and swollen, and you can't put any weight on your leg, it may be time to make sure that you don't have any other serious injuries that may be happening. And if you've tried everything that we talked about today for about 2 weeks and nothing is helping, that might be indication you need some professional help. And what's a professional going to do for you? One, what we can do is have a good look inside your knee to rule out some other more serious conditions to make sure patellofemoral pain syndrome is what it is. And also we have a bunch of tools and equipment in the office and treatment techniques that can really help get deep into the tissues to loosen things up. We have equipment to help strengthen the muscles, and also we have things that will help with creating the right healing environment to help you with your pain. So if you think patellofemoral pain syndrome is what you've got going on, try some of the techniques we utilized or showed you today, and hopefully you'll be feeling better in no time.